going to start with our discussion on the paid family medical leave. And I know because of the timing of this, when we were going to have this session first time, you were going to actually bring this to the Senate, and then it was going to run to the House, and those things already kind of happened. So if you can kind of run this through and then see what happened since the last time we met, and then where we are right now, and then what's the timeline for this to go live. Oh, you're on mute.
Thank you. You would think after 2 years, I would have remembered to go off mute, but thank you again to both you and Sean for having me on today. I so enjoyed our conversation before that focused predominantly on what you just brought up, which was the really centerpiece of my legislative agenda, which is Senate Bill 1, the Healthy Delaware Families Act, that would establish an up to 12-week paid family and medical leave insurance program here in Delaware for Delaware workers. This is a program that would provide partial wage replacement for Delaware workers who are out on leave to welcome a child into their family, to take care of their health through a serious health condition, or to take care of a family member through a serious health condition. When we talked last, I had introduced what was the original version of Senate Bill 1 and was engaging in stakeholder conversations across the state with stakeholders ranging from workers and public health advocates and providers to, of course, the employer and business community. In that time, I engaged in about 200 hours of discussions and negotiations on the issue of paid family and medical leave, because this legislation would establish an important new program that at some point would touch almost every Delawarean. Because these life events, welcoming a child into your family, a serious health condition, or a loved one with a serious health condition, at some point, practically all of us will face at least one of those life events, whether it's the joy of a child or the stress of a serious illness. So in the last year, we've engaged in about 200 hours of conversations, and I put forward what we call a substitute bill, which is basically taking the original bill and inserting in its place a new one that kept a lot of the original legislation, but also made meaningful compromises at the behest of different stakeholders, including small businesses and employers, to create a program that meets worker needs while easing our businesses into this new program. One of the big changes is that we tied the new law more closely to the Federal Family and Medical Leave Act, which provides many workers with up to 12 weeks of unpaid job protected leave. We made the requirements in this bill really reflect a lot of the same requirements in that legislation, so that there wasn't a duplication of law in a confusing way, and that businesses, many of whom are already abiding by the federal FMLA, wouldn't have to do a ton of things differently. But of course, what would be different is that when workers are out on leave, they would be able to access this wage replacement, which for so many workers is the difference between their ability to take care of their health or to take care of a loved one or to start a family. And I'm proud to say that the substitute legislation was endorsed by Governor Carney, who was a fierce champion of this legislation. In fact, it was one of the main bills that he highlighted as a priority for his administration in his State of the State address in January. And it's received support from organizations ranging from the AARP of Delaware to the Delaware Academy of Medicine to Christiana Care and Nemours hospitals. It's received the support of both Democrats and a number of Republicans in Delaware. And I'm hopeful that as the bill moves forward, it will receive bipartisan support in the House of Representatives. It already passed the state Senate this past week. It passed through committee in the House. And so soon it will come to the House floor for a vote there. And again, I'm hopeful that we can get broad bipartisan support in the House, and then eventually, of course, send it to Governor Carney for his signature, which he is excited to provide. And so once we pass it, then we'll start implementing.
So you mentioned some compromises. So what was the least favorite one that you had to kind of make? That's
a great question. Well, I don't know that I could pick one least favorite compromise that I had to make. I think every compromise is a little bit difficult, but that's governing, right? I mean, governing requires compromise. I could defend every component and the rationale behind every component in the original bill. But in the substitute, a couple of the changes where we increase the eligibility requirements. So you have to work for longer to be able to access the benefit. The covered relationships, we've restrained the covered relationships for family caregiving. So if a loved one is struggling through a serious health condition, what is your relationship to that loved one? That's more constrained than it was in the original bill. Now it's just parent, spouse, and child. We've not automatically included certain smaller businesses. Every other state that has this program, it's universal in that it automatically covers every business of every size. This would only apply to businesses over a certain size, depending on the aspect of the program, either 10 or 25 employees. And so those are some of the changes that we made that were particularly difficult. But I believe that it's important we get this across the finish line, that we get this benefit in the hands of as many Delawareans as possible. And as I said, governing requires compromise. And while it's not everything I want, it's a really meaningful bill that reflects both meaningful compromise and meaningful change for Delaware workers.
So we have to be solution oriented, right? So we have to make it work in a way. So then otherwise it will be forever to get them done. So how are the employers? You said there's the size limitation with the employers, over 10 employees, I guess. So how are the responses that you are getting from the employers? Do they see this as more like a extra cost to them, or do they see that as a benefit? Like as an employer, I can tell you that we see this as a benefit that we can actually expand this to our employees. I do provide no cost short-term disability for my employees, and then something like this would be also beneficial for us to add. But I don't know how the other employers are responding to this.
Yeah, and I appreciate you saying that, because that's exactly right. And that's the reality of this program. There's certainly diversity of thought. Some employers are incredibly supportive and see it as exactly what you just described, which is a real benefit. That's employers ranging from incredibly small businesses like Design LLC, which just has a couple of employees, to medium-sized employers like Brouhaha, whose owner is incredibly excited and agrees with exactly what you just said, which is that this is really a cost-effective way to expand the benefits that they provide to their employees. To large employers, including, as I mentioned, entities like Christiana Care, who's the largest private employer in the state, who believe not only that this is a good public policy from a public health perspective, but that this policy is actually really necessary to help recruit and maintain the healthcare workforce of the future, because we know this benefit is so in demand. And if Delaware has this benefit, we're going to be able to be better positioned to attract more workers and to keep more workers in our state, including in healthcare. And of course, we know how challenging these times are right now in terms of worker shortages and worker recruitment. And so a lot of businesses truly do see this as a benefit. The state chamber, because of the compromises we made, is in a place where they are comfortable with the bill. And I believe as we implement this legislation, as both employers and employees are now able to see this benefit in action, the support is only going to grow. That's actually one of the reasons why in New Jersey and New York, where they've had this benefit for years, more than 70% of small businesses are supportive of their state's paid leave programs after having experienced their benefits. We know that once these programs are implemented, both employers and employees alike receive the benefit from them.
Sure. So from the employees' standpoint, who are the biggest supporters? Like the group that you mentioned, now this is going to be maybe initially limited to the wife, husband situation and the father and mother and the kids, right? The immediate family. But then it can always, well, that's a start, right? So we can always start from there and then improve. One question is, can it not be done at the employer level, so that employer can pick and choose whether or not they can expand that to a larger
network of people.
Mm-hmm.
So that's a great question. And one of the things we do allow in this policy, in the legislation, is for employers to have more robust benefits through private options. So we create a state benefit, which is sort of the public option, which is a floor. And then we also empower employers to either offer these benefits through private options that are more expansive, and actually they can opt out of that portion of the state program that they offer, either in whole or in part, or they could provide auxiliary benefits on top of the state floor public option. So there are opportunities for employers to provide more robust benefits than what the state is offering here. This is just to ensure that there is a basic floor, sort of a safety net. But if employers do want to provide even better benefits, they're entitled to do so. And there are multiple options for them to be able to do so under this legislation.
Right. So now you said that it's already almost final or about to be final?
So it's on the verge of passage. So it already passed to the Senate. It passed the Senate 14-7. It has now, just this past week, passed through the House Health and Human Development Committee, on its way now to the House floor, which is essentially its last stop before it goes to the governor. And so I'm hopeful that the House will pass it soon. I'm confident about the House passing it. They are passionate about this, as is, like I said, Governor Carney, who's been a real champion of this legislation. So it's almost there. It's almost at the finish line, which is very exciting.
When did you say the House is going to vote on this? When is the voting for the House?
It's not totally set yet.
Okay.
But it's now through committee, so it could be soon. Obviously, the General Assembly's in through June 30th.
So now, once it's passed, then when is the go live then?
Sure. So, of course, I would love this benefit to exist already yesterday. But once it passes, the state does have to essentially create the program from scratch. So that takes some time. They've got to hire the staff. They've got to issue regulations to flesh things out in a bit more detail to provide the clarity for employers and the information for employers in as great detail as possible. And so we would pass the legislation, and it then would not actually go into full effect until 2025 and 2026. So the program is funded through a payroll deduction that would begin in 2025, and the benefits would be dispersed beginning in 2026. So a little ways off. And of course, I wish it was yesterday, but we've got to have time for everyone to prepare, including the state. So that's the timeline for implementation.
So anything that we can help you with this?
Well, I think to your point that you made earlier, you all see this as a benefit to you as an employer. And I think sharing that, there are a number of employers, including, for instance, like I said, Christiana Care, Nemours, have drafted letters in support of what is now called Senate Substitute 2 for Senate Bill 1, and emailed the legislature to say, we believe that this is a positive benefit for employers and employees alike, and we urge you to support this legislation. Number of folks are speaking up, and I think that's a great way. Obviously, what you're doing right now, having me on in these ongoing conversations we've had about this bill, educating folks in your networks, that's critical. But I think your voice really matters, and people, of course, respect you as a leader in this state. And so letting legislators know that you support this bill, I think, is an important component of getting it over the finish line.
Absolutely. I mean, other than United Medical and the groups that we own, we also provide services for more than 50 practices, in total more than maybe 1,200 employees in Delaware only. So it would be definitely beneficial for all practices. So, and the main thing is if we can actually help our employees because these times are until you have one of these times, you are really not. You really don't understand how important to have these benefits, because everyone is going through these. Just lately, a couple of our employees, they did have some family emergencies. I went through, even with it, like not our human friends, but with like I lost my my dog, and just the time of it is incredible loss, and then going through that time, and then like prior to that, and this is if it's affordable, and if we can actually make this work, it has to start from somewhere. So if the way that I see, if someone's mother is going through trouble, and in our culture here, there are not many options, and any option is extremely expensive. So if someone can take some time off and support their family, and then not to worry about their job, I think that's extremely important. So, and if we are able to provide that for our employees, that would be huge for us. And Sarah, one of the things that we have for you is with the the overall healthcare, and your perception or perspective of your healthcare. I'll actually maybe open that question, or maybe more like in the dialogue, like the way that we do these days. Our patient care, our approach to patient care changed. So social determinant of health is helping us to understand what's happening with our patients. So even when we go through those, what we see is patients are struggling with different things. This can be like the food insecurity. This can be the depression that they are dealing with because they are lonely. This can be the transportation issues. So there are several different problems that they are going through, and this is contributing to their health issues. And if the healthcare provider doesn't understand these issues, then they really cannot help them. Now, as an employer, if I don't really help, if I don't understand what's happening in my employees' lives, then I cannot really work with them in a way that, or they cannot work with us in a way that this is just, it's not like you can separate it. Well, when you are here, you cannot think about your dying mom or dying partner or dying, child. So it's not, we are all human and we all have feelings. And that's why I actually, when we wrote you first time last year, that helped me to understand the issue a little bit better. And then, like, if we can help everyone to be on board with this in a better way, that would make us happy. Now, our second topic, and I was going to call you, and then I didn't, because you are in meetings. So you are called into the White House, and then I thought maybe you were going to tell me no. Then I said, let's just be prepared. And then I just told you this 3 minutes before the meeting, and I apologize. Now, I apologize, but I really shouldn't, because, well, you are a great role model, not just for one group of people, but for anyone, any family, any parents. They would be proud of their kids to be in your position. And I said this to you last time as well. And I'm so glad that you are doing what you are doing.